All right, and we are live. Welcome back with Murphy Mac to another episode of the Fitness Beginner Podcast, where we help you get started on your fitness journey. How's it going, everybody? We're back with another podcast episode today. We have another fun one for y'all. We have an interview that I'm pretty excited to get into about because this guy's done some pretty cool things that we're going to talk about in the podcast. And his name is, sorry if I butcher this, Kwame. That's it. Kwame Terra. That's it. So we're gonna bring him on. We're gonna bring him on to the podcast now, and I'm gonna let him introduce himself. Just tell everybody a little bit about yourself, and then we'll get into it.
Yeah. What's going on, y'all? My name is Kwame Terra, CEO and founder of Bear Health. Born here in New Orleans, Louisiana. Grew up in Houston, Texas. Played sports, baseball, track, cross country, basketball, football all my life growing up. Ended up a runner. I ran cross country in college here at Xavier University, Louisiana in New Orleans. And now I'm all into health and fitness. I run a health app where basically we help people improve their overall health and wellness by giving them a health score, kind of like a credit score, but for your health. And then that score changes in real time depending on how you change. So if you go on a run or a walk one day, your score goes up a few points. If you get 3 hours of sleep one night, your score goes down. And then based on those changes, we make recommendations for how you can improve, as well as connect you with resources like fitness coaches and doctors, and basically just experiences that can help you improve your overall health and wellness. So it's a little bit about me.
Yeah, that's a pretty cool app. I want to dive a little bit more into your app and this health score thing. That's pretty interesting. How did you come up with this idea of like making it kind of like a health score, like a
Yeah, so
credit score? That's pretty cool.
yeah, my first thought when I came up with this idea, or really when I saw the problem during the COVID-19 pandemic, and how the virus was basically people who had comorbidities like hypertension, type 2 diabetes, and some cancers, they were having the worst experiences with COVID.
Hmm.
And my first thought was like, I don't think we know how bad we're doing as it relates to our health overall. Like, I think we know we're not doing great. We know we need to be eating better. We know we need to be moving more, but I don't think we know exactly how bad we're doing. And I don't think we know that if we don't get it together, we can have a heart attack at age 45, or we can have a heart attack or stroke at age early 50s, late 40s. And oftentimes cutting life too short. And so I just wanted to be able to communicate that clearly to people, and then provide a platform where not only they can track it, but we can track their changes over time, and make recommendations again for how they can improve, and just remind them and let them know what kind of risks they're developing based on their current lifestyle. So it's a pretty comprehensive score. You get a number between 0 and 1,000, and it's based on your physical activity, your mindfulness, your nutrition, your mental well-being, a variety of factors. And because we're more than just like our fitness, right? That all
Hmm.
that stuff goes into health. So that's kind of how I came up with it.
So how does it track all these metrics? You hook it to like an Apple Watch,
Mhm.
Whoop, things like that. Is that how it works?
Yeah, so we integrate with pretty much every fitness tracker. So
Hmm.
Fitbit, Garmin, Apple Health, Google Fit, Samsung Health, Strava, whatever somebody uses to track their health, we can typically integrate it with it. And if we don't have a direct integration, as long as they're sending data to Apple Health or Samsung Health, then we can get it. And then again, like if your resting heart rate increases for an extended period of time, a couple of days, you'll see a reduction in your overall health score, as a consequence. And so people get to really see like how their day to day life affects their health risk.
Now, as far as nutrition goes, do you track your nutrition in the app as well? Does that affect your score?
Yeah, so right now we track nutrition through survey data. So we ask people, how often are you eating 2 or more servings of fruits and vegetables per day? How often do you eat 2 or more servings of fried food per week? Right. But these metrics, based on all of the longitudinal data, will let us know, if you're eating at this frequency, if you're eating fried food at this frequency, your health risk increased by this much. Right. And so based on someone's answers to those questions, then we communicate a sort of health risk. When it comes to nutrition, right, we're not right now doing any AI software like on our platform where you can like take a picture of the food,
Hmm.
and get kind of like a breakdown of what all is in it. And honestly, I'm not too convinced of those just yet. Like, as far as the
Yeah.
accuracy goes, what's going to be really useful when it comes to tracking nutrition, most importantly because people aren't going to be honest about what they're eating at the end of the day, or just aren't aware, is going to be like continuous monitors, like continuous glucose monitors, where
Hmm.
you know nothing changes like your glucose depending on your diet, you know. And so if your glucose levels, your blood sugar levels are elevated for an extended period of time after eating a certain way, then we can, you know, pretty reliably predict what you were eating, you know. And so for now, we're using these assessments, and that goes toward a score, and you know, we work with what we got as far as like the self-reported data, but that's how we're tracking nutrition right now.
Is there any other features within the app besides like the health score part of it? Is there anything else like does it recommend workouts, diets, things like that?
Yeah, yeah. So we're relatively new. We just launched the app last year at the beginning of 2024, and part of what we do is we center health in different festivals or cultural experiences. So I'm sure everybody's familiar with Mardi Gras here in New Orleans, and so last year
Mhm.
we did the Mardi Gras Steps Challenge, where whoever took the most steps during Mardi Gras on our app won $5,000. And so we really try to give people an opportunity to move just a little bit more than they would have, right, while they're doing things that are obviously typically not necessarily health promoting, right, like, you know, drinking a lot during Mardi Gras or, you know, eating at the fried chicken festival. Last year at the fried chicken festival, we did a calorie burn challenge after where after the weekend of the fried chicken fest, you had an opportunity to win some money, you know, if you burn a certain amount of calories the week following, right? Um, and so that's one of the major features is these challenges where people can join for an opportunity to win something and gets people to move again just a little bit more than they would, you know, on a regular everyday basis, and really focus on the experience instead of just telling people, hey, go take 10,000 steps a day, which can be boring, and you know sometimes people can kind of get motivated by that, but it really what we try to do is help people focus on experiences and like living in a health promoting way instead of like becoming obsessed with tracking your every aspect of your health. Like definitely track these things because we can't improve what we aren't measuring, but let that be a background feature, and we focus on like the experience, the competition, the camaraderie, right, the community, because all of these things are really what um, would lead to health ultimately.
Yeah, it's much easier to do if you have people to do it with. If you have somebody to go along with you, it's the
Hmm.
journey's a lot easier. I always recommend people getting you a buddy, like a workout partner, buddy, somebody to push you, hold you accountable. It's
Yep.
definitely it's a lot better when you have a community with you, especially
Hmm.
when it comes to running. You mentioned you're a runner.
Yeah.
I just started running recently. Well, not recently. It's been a little bit, but yeah, running with somebody so much easier than trying to run by yourself.
Oh yeah, yeah, man. I mean, and that's part of why the run club community has taken off so much right now.
Hmm.
Um, I was talking to somebody about it yesterday. Just, you know, any sports really, uh, you form strong bonds with those folks, right? I'm sure you know people that you grow up with playing sports. Like those are your boys. You know, I know
Hmm.
all my baseball teammates, all my cross country teammates, and whatnot from college. And the main thing that creates such strong bonds is shared suffering, right? I'm sure you've heard of that concept where like if
Hmm.
you suffer with somebody, you just develop a stronger bond with them. And I think on some level that may be part of what's happening in these run club communities is that a lot of people are getting out there and moving, some for the first time in years, right, running their first mile in years, and you know obviously they're suffering through that. And so then you know endorphins are flowing, and there are all these other people around who are kind of on the same journey, and then people are starting to build long term friendships. I know people who are in my run club, they went on a trip together, like in a whole another state, and they just met last year. But they're all on this kind of like growth journey together as it relates to running. And so, yeah, a lot of good things happening in the run club community.
Yeah, it's interesting you mentioned the run club. We just started one in our local area. It's very small at the moment, but
Mhm.
we're trying to build it up and get some more people going. So, uh, run's definitely on the rise right now for sure. You're seeing a
Mhm.
lot of it. It's very trendy right now.
Yeah. Oh, 100%. Hopefully it doesn't just. Hopefully it's not just a trend. Hopefully we figure out how to get this to stick. You know.
Oh yeah, I'm sure it's definitely one of those things. Some people will stick around, but you definitely have some people that will fall off over time. But I
Mhm.
think it's people in general, in my opinion, are starting to become more like not healthy, more aware of that they need to be taking care of their bodies. They need to be putting better foods in their body, taking care of exercise and things like that. So I
Mhm.
think it's fitness as a whole. I think it is on the rise, and I think it's
Yeah.
here to stay for a good time. So,
Yeah. Yeah. No doubt.
so when it comes to your app, have you seen? Is there any other apps out there like this? Is there any major competitors that you have? I've never
Uh,
heard anything like this before.
yeah. So yeah, I think there are tons of apps that have what you call like health scores, right? They have
Hmm.
sleep scores and different things like that. But no one no one honestly has really put it forward as like a credit score for your health.
Mm-hmm.
I think that framing is unique, because the technology is the technology, and then there's not much. I wouldn't say it's uncommon, right? The health score is uncommon, but it's not so unique that it's like this revolutionary feature. What I think the framing is unique, and it's going to help people connect with it a little bit more because they understand the concept of a credit score. So okay, well, there's there's something similar. There can be something similar for my health, right? So there are all of these data, pieces that you have. So your blood pressure, your cholesterol, your glucose, how much activity you're doing, what your nutrition is, how well you're sleeping. All of these points, these are all factors that go into your overall health. So for there to be a score that represents all of that, then that, like, people can understand that and get behind that, as opposed to all of these different scores that they might be tracking on on other platforms. And then I think our approach is different. Instead of just throwing our technology and hoping that it sticks, right? We kind of engage on a community level to drive people onto our platform. That, along with these major challenges, where again we just try to incentivize people to move a little more. We even gave away 2 tickets to the Super Bowl at the beginning of this year. For if you took 59,000 steps in a week, you were entering in for a chance to win 2 tickets to Super Bowl 59. And again, we're not trying to get people to do crazy, athletic feats and stuff like that, just to be, although some people have done some ridiculous stuff, and they've seen incredible results. But yeah, I think that's part of what makes it unique. And in addition to that, we have what we call the health score report. And so all of the users are tracking their individual health score, and using that to improve themselves. But then we're able to extrapolate all of our user data into what we call the health score report, where we're able to compare and contrast, like, on a community level. So what's happening in New Orleans compared to what's happening in Mobile, for example. And let's say the average health score overall in the Mobile community is higher than it is in New Orleans. Well, what can we learn from Mobile that's not happening in New Orleans that we can then, apply to the New Orleans area to help improve it? So I think that is part of what makes us a little unique as well. So we're not only doing individual tracking, but we're tracking on a community level, and being, like, open and intentional about that. And that's part of our product, is like to improve the health of communities.
Yeah, that's pretty cool that you can do it by like area. I like that by region because then you could definitely pick up on some trends. Like, hey, what are these people doing over here that these people are not doing? I think
Mhm.
that could help for that specific area. So that's a pretty cool idea. I like that. I like to see some of
Yeah.
the results that y'all get from that because I know, like, speaking of that's where I'm from, Mobile. So
Okay.
I don't I don't know, the fitness, like, outdoor community to me is not very big here. It's not. But like I went to Arizona about 2 years ago, and the outdoor community there was massive. Like everybody was out either hiking, running, mountain biking. So I would go to say that like Arizona is way more active than Alabama, like 100%. So like being able to see that data would be a cool comparison to see where you could like learn from other communities. I think that'd be
Right.
pretty unique.
Right, because there are going to be overlaps, right? There's going to be
Hmm.
consistencies between the communities. Okay, well, they have this same profile. They have the same, current status, but why is this community so much more active than this one?
Hmm.
Well, they have 25 run clubs in this community. Okay, well, maybe we need to pop up a run club in Mobile, right, and see what happens there, and then we can track it month over month, right? So over the past 6 months, the average health score overall in our community, or in our user base, has gone up by about a point or two. Right now, there are like 2,200 people on the app, so for it to go up really any measure is important, and like seeing that is really what I'm after, right? That's where I get the most meaning, is being able to see that collective improvement on the community level. And so, yeah, man, that's pretty much what we do over here. And obviously, we're trying to take this across the country, across the world, and again, improve the health of our people. Man.
Yeah, and I like how you also framed it as a credit score. You mentioned other apps have like these kind of scores. Thing like speaking of Garmin, they have like your body battery score,
Mm-hmm.
things like that. And something that I've come to have problems with myself with these scores is that sometimes you don't really understand what they mean, like what they are, what they're telling you. So I think being able to break it down like a credit score, I think that may relate better with some people. And may be able to like understand what it's telling them better. I don't know how you break it down in your app, how you show the score. Maybe
Yeah.
you can explain that a little bit more. But like
Mm-hmm.
being able for people to digest the info and understand what it's telling them, I think will go a long way. Because even myself, somebody that's into fitness myself, even I sometimes don't understand all this data. That's because if you track a workout on your Garmin, your Apple Watch, it's going to give you like 1,000 different data points. I don't know what all those mean. You know what I'm
Right.
saying? So being able to like give people that information and they actually digest it and understand it, I think that'll go a long ways when it comes to people actually using the app.
Yeah, 100%, man. And that's a good point because, I talked to quite a few technology developers when I first had the idea, and a lot of these, came up that had these comprehensive scores in a bunch of different categories, and then they had these, inner age scores and stuff like that. And I like the inner age score, like your biological age and whatnot. I think that that's important, and our health score is connected to that inner age score as well. But it's still kind of an abstract concept, you know, to really, and it doesn't necessarily say good or bad. It just says how old you are compared to, how old you are on the inside compared to how old you are on the outside. Again, I'm not saying people can't grip that and grasp that concept, but compared to a number, I think people can understand that a little better. And if you show them, okay, if you have a number between this, you're in the poor category. If you have a number between here, you're in the fair category. Here, good, very good, and excellent. And that's kind of what we do. So anything below 480 is considered poor. So your risk
Mm.
of having a significant health event on any given day is higher than the rest of the people on the platform who have a score above that. So that's the poor range. Fair is going to be from 480 to 549. Again, elevated risk, right? So you maybe you're a little overweight, or maybe you're obese, or maybe you're not as active as you should be, um, and so you'll get that score. And then 550 to 610 is considered good. So you could say you're aging at a normal rate, right? You probably won't have a significant health event, or you're not necessarily accelerating your aging to the point where, um, you'll probably just live to the regular life expectancy in the country, right? But then anything above that, you're starting to you're aging at a slower rate, right? So you may live a little longer than the average person, and that's really what the score is trying to communicate, kind of like what your health trajectory is. And again, I think people understand it, and people are committed to improving their scores, and being able to see changes every day is really kind of what kind of keeps people engaging with the platform.
So your numbers pretty much correlate directly with the credit score. So I mean
Oh yeah,
that
pretty
makes
close
sense.
to it too. You know what I'm saying?
Yeah.
Yeah, I mean it goes up to 1,000.
Hmm.
Not that many people get up to 1,000, but
Yeah.
yeah, anything above 680 is considered excellent. And we may even reframe it, because we're in our beta app right now. We haven't even officially launched. We will be officially launching in October. Um, but yeah, maybe we try to connect it really closely to the credit score. And I know our
Mm.
developers are working with the folks at FICO now to kind of bridge that messaging a bit, and so we'll see what happens there.
So who do you see using this app? Like who's your target market for this app?
Mhm.
What's the goal?
Yeah, so when I came up with the idea, my focus is the Black community, because the Black community was experiencing the worst when it came to COVID, and a lot of disparities exist here, especially in the South. Um, and so yeah, just trying to solve that particular problem first, because again, it's kind of the greatest in this community. Um, and then so far that's pretty much what we've done. So different conferences and stuff that we go to, different um, you know events and experiences that we collaborate with Rome Club and stuff like that. They kind of focus on the Black community. And yeah, we gotten some good results so far. Like I said, the scores have increased overall on average, every month over the past 6 months, and being able to see that has really been encouraging. And so as we focus on right now, obviously anybody can benefit. Anybody can use the app. It's not like only Black people can be on the app. So anybody can use the app and again benefit from being a part of the community. And again, as it grows, things just kind of take on a mind of their own. And as it does that, then we'll meet the needs of everybody, because we're really a health equity company. Health equity is about giving every individual the best chance that they can have to achieve the best health that they can achieve. And um, ultimately we're just trying to be responsive to everybody who's trying to benefit from the platform that we built. So even though starting off with the focus on the Black community, again, as we reach more people and connect with more people in different backgrounds, then we'll continue to refine the platform to make sure that everybody everybody can benefit.
Have you seen any differences when it comes to health within like the black community compared to, other communities? Have you seen? Is there any difference there? I mean, to me, I don't necessarily think it'd be much of a difference. I think it's more based off of your region, like where you're located at. But
Mm-hmm.
maybe you've seen
Yeah.
otherwise.
So
Have you
yeah,
seen
yeah. I
anything
mean,
there?
ultimately, it does come down to what are called social determinants of health, right? So these are like your economic status, right? Your like what kind of access to healthcare you have, access to food you have, right? And no matter your skin color, if you're in a lower socioeconomic um, environment, then you're going to have a lower health status. Um, and so yeah, across the board, when it comes to like what we're trying to do is we'll identify really like differences between different zip codes and be able to basically make recommendations for how to improve those communities' overall health, right? And again, like you're saying, it's typically it's based on socioeconomic status. Just so happens to be the case that low socioeconomic. I wouldn't say just so happens to be, but it is the case that black people are affected more by low socioeconomic status. And so, yeah, I mean, the differences that we see on the app right now, between races, I would say, um, you know, people who aren't black on the app do have higher health scores on average. However, those are the folks that we're engaging with are typically like college students. Like if they aren't from the black community, they're college students. So also like younger, healthier,
Hmm.
you know. And there's just certain aspects of some of the leaders that we also engage with, like in this community, they tend to score a little bit higher again. So these are people in like influential positions who, are well to do and whatnot. So and those are some of the differences that we see so far. But the current average health score on the app is about 541, so still in the fair range. We're
Hmm.
creeping up on the good range, but for the most part, we got some work to do.
So what you mentioned, you have some college students. Are most of your people using the app younger as of right now? And is that the goal, or do you want to get all ages? I'm assuming all ages would be your
Yeah,
goal.
yeah, I want to get all ages. I want this to be something that's endemic. Just like everybody has a credit score, I want everybody to know their health score.
Hmm.
Um, our company is based on a college campus, and so a lot of our activations have been, in the college community. I would say maybe 400 of our users are in that demographic, that college range. A lot of them are kind of older Black women. They've been drawn to the platform a bit more. They really like walking, and a lot of what we do is kind of encourage
Hmm.
people to walk. And the split is about 71-30, or 70% women, 30% men. So we do need to have some work to do on getting men a bit more involved. And
Hmm.
honestly, the run club movement has gotten more men involved with the platform. Um, but yeah, that's yeah. The focus is ultimately everybody, right? Because one thing, for example, I'm sure you've gone to the doctor and they ask you about your like family medical history, right?
Hmm.
And has any of your they'll ask you, have any of your first degree relatives had a stroke before 50? And you're like, well, actually, I have no idea, and but that's like important information to know. So what we want to be able to do is help create these kind of family trees for folks, whereby they say their grandmother gets on the app and answers all her questions about her current medical status and history, and then it just kind of like funnels down to them, to where they don't even necessarily have to be able to answer that question on their own or call their grandmother. They can just pull up their app and show the doctor, hey, this is what's in my family medical history, and again, the doctor will be able to create more, again, tailored plan for that patient based on that. I guess long term, some formal integration with the healthcare system where most of the data is kind of inputted by the physicians, at least in the medical health section, and then that way it's not just kind of self-reported, because
Hmm.
people can lie to themselves about their health status, and then it really could take off again and become something that's truly endemic to the space. But what I'll say about focusing on the Black community, the last thing I'll say about that is that when when you focus on those that have the toughest experience, right, who are dealing with the problem the most, um, what you learn, the impact and learnings can be scaled upwards, right? So everybody can benefit because you have to get the most creative about coming up with solutions, right? If we just targeted, people who are in the fitness community, right, who
Hmm.
are kind of active and looking for different, varied, whatever they come up with for what they're looking for, then those learnings won't necessarily scale down, and naturally folks get left behind. And so by starting with a community that's having the toughest time as it relates to health, then everybody ultimately can benefit from what we learned and throughout this.
Yeah, that's awesome. I think y'all got a great a mission that y'all are going after. Well, we talked a little bit about your health history,
Mm-hmm.
and I think that's going to be it's going to be very interesting to see what AI does with health history. I think it's going to be a good thing overall because I think when it comes to like getting diagnoses and things like you said, it'll already know that your grandma had a heart attack when she was 47, whatever. Like I
Mm-hmm.
think that's going to go a long ways in the future, and it's just going to help our healthcare even more. The more information they can get about you, the better, and the more AI, the AI could probably predict what's wrong with you better
Yeah.
than most doctors could. So
Mhm.
I think we got a lot of room for growth when it comes
Yeah.
to healthcare. It's going to be in the next 10 years. I think it's going to be crazy what AI can do when it comes to healthcare.
Yeah, I hope it becomes healthcare and not disease management. Really, that's what I
Yeah.
hope that AI does for us. Is like it helps us
hmm
with early detection of diseases that are taking people out, sooner than they should be. So,
Yeah, I definitely think we should be taking like we should be preventing the problem and not taking care of like managing the problem. So
yeah.
somebody said that the other day. I was doing an interview and he was a nutritionist. He said, yeah, he wanted to be a doctor, but then he was like, no, then I realized I wanted to be a nutritionist. He said I wanted to be able to prevent the problem rather
Mhm.
than taking care like fixing the problem after it's
Absolutely.
already happened. So I thought
Yeah,
that was pretty unique.
yeah, 100%. If you had to guess, what percentage of healthcare dollars do you think are spent on treating preventable conditions?
What percentage of healthcare knowledge?
Dollars
Oh, dollars.
are spent on treating preventable conditions.
Oh wow, probably got to be in the trillions. I don't know.
Yeah, no, it's definitely in the trillions. But what percentage of our overall healthcare spend do you think goes to treating preventable conditions?
Oh shoot, probably 85, 90%.
Yep, exactly. That
Yeah.
number should be as close to zero as possible,
Yeah.
right? If we're doing our job as public health, you know, practitioners.
Oh yeah, it definitely. Yeah, I would say probably 90% of the problems you have could be fixed just by changing your diet and moving your body a little bit.
Yep.
It goes a
Yeah.
long ways. When people don't realize that.
Yeah. No, I was talking to a guy the other day. Maybe he was early 50s, late 40s. He told me he just got diagnosed with hypertension, and he's not dealing with it anymore. And I was like, oh well, what did you do? He's like, well, I stopped smoking, I stopped drinking, and I started running. Now it's gone.
It makes a big
Really
difference.
simple. It's when you stop putting the things in your body that you know are causing problems, and you start doing things that are good for you, then your body, you know, regains that state of health.
It's crazy what happens when you actually take care of take care of yourself.
Hmm.
So, and what is I don't think you mentioned what is the name of the app?
It's called also our beta app that's currently out is called Dacadoo. It's DACADOO, and you can download it in the App Store, Google Play Store. We'll link the access code. You'll need an access code to enter the app,
Mhm.
and enter that. Enter your information about your profile. So we'll ask you about your height, your weight. We need some of that information to kind of start generating your health score. We'll ask you about your age as well, your location. That again helps us kind of compare and contrast between different cities. Currently, the app is free. When we launch in the May or in October, we'll likely migrate to at $5 per month or $50 per year to start. Eventually, once we're able to make money in different ways, we'll ultimately try to make the app free for everybody. But to start, it'll be that, and yeah, you'll get your score. Your score will change day to day, week to week, depending on how you change, and then based on those changes, we'll connect you with resources and experiences that can help you improve it over time.
Yeah, I think that's gonna be a pretty cool app, and I think you'll be able to learn from all the data that you're getting, especially with the beta that you're running, and be able
Hmm.
to make those scores even more accurate and better for people to use in the future. But
Yep,
yeah,
yep.
changing directions here. I want to talk about this world record that you set because I'm very interested in this because I actually just ran a 100-mile ultra marathon like 2 months ago. So
Oh,
this is very this is up
hmm,
my alley right here.
yeah,
So you you set the world record for the most steps taken in 30 days,
that's right.
correct? And
Hmm.
you did over 2 million steps. That's insane. So I watched the little video uh, that they sent me, and it's when you said 2 million steps, I was like, okay, that's a lot of steps, but like that's doable. And then they
Hmm.
kept breaking it down. It was like, I gotta walk like 12 hours a day, 30
Hmm.
miles a day. I'm like, oh, that's a lot. That's way more than I thought. Like when you said 30
Yeah.
miles a day, I was like, that's insane. Like that's
Hmm.
I don't even know. So
That's a
what
50K a day.
yeah, why would you even do this? Like what made you want to do this?
Yeah, that actually started a year before. So a year ago, yeah, a little over a year ago, I asked one of my users and kind of team members if he would help me prepare for a campaign. So I wanted to do 1 million steps in 30 days to raise $1 million for our company last year. And so he's like, "Oh yeah, I help you do it." He's a local doctor, community health doctor in the city, and he was like, "Yeah, I'll help you." Right. So we start kind of training, you could say, in May, and I'm kind of distracted. We're going through some stresses in the company, and but he's locked in on getting these steps done. Well, he ends up doing 1 million in 30 days, so about 30,000, 33,000 steps a day, 15 miles of walking per day, a little over 5 hours a day of walking. He loses 20 pounds and gets taken off his blood pressure medication, right, in 30 days. And so now I'm like, oh, that challenge has changed his life. It's transformed his body, and he's kept the weight off all of it since, right? It's been over a year now. But it like also changed something psychologically to know that you can achieve something like that. It's a 54-year-old man, He passed me the baton in June, and so I knocked it out in June. Uh, the next month, another user had reached out to me and asked me if we were doing any more challenges this year because we had finished up the Mardi Gras Steps challenge at the beginning of the year, and he was just looking for another challenge. I was like, well, you want to try to do 1 million steps in a month? And he's like, sure, why not? And he knocks it out in 28 days, so he does it faster than both of us. And this guy's actually averaging about 1 million a month this year so far. He's probably about to break the world record. If there's one for the most steps in a year, he's probably about to break it. The next month, two users did it in August, and then another one did it in October. So then we all got to talking, like, what's the world record? Do you think any of us can go after the world record? And when I was looking at my calendar this year, I was like, I'm going to be busy all summer traveling. Might as well go for it in May to kick off like the campaign for the official launch of the Bear Health app this fall. And so I just 3 days before April, made a plan and just went after it, man. So the first day I did like 67,000 steps, like 31.45 miles. Um, that was that was a difficult day because I just didn't know what I was really getting myself into. Like I hadn't done a rep really before that, to like really test out what it was going to
Hmm.
take on a daily basis, how much fuel I was going to have to be taking in, how much hydrating was I going to have to do, and like how that was going to affect my overall schedule for work. Because at first I'm like, okay, well I can walk around this meeting, I can walk around this, interview or whatever. But eventually it was like I can do these things around my walking. Like walking had to become my job, like my overtime job for 30 days, And so yeah, the first day, I walked like hour and a half in the morning, and then I also coach my run club. We did some training at the track, and so I'm walking around the track as I'm coaching everybody for the workout that day, and then I'm walking around the fitness center here at Xavier throughout the day just in case I need to go do something at my office. And then that night I walked to a friend's house downtown. That was about an hour, and then I walked. And then we went on like a 2 hour walk. We went and got some food, and then and then walked back, and I still had like an hour walking left. So I'm like at a 13, 14. This is the first day, and I'm like, I got to do this for 30 days, you know. And I just woke up the next morning, 5 a.m., started walking. I mean, I left my car in so many different places during that month because it was just like, I'll make it back. I'm going to walk back to my car eventually. Um, and so, yeah, that was the first day. The second day, pretty much the same thing, 67,000 steps. And that was pretty much my life for the next 30 days. My highest day was 87,000, like 42 miles of walking. I ran a 10K in the middle of it, the Crescent City Classic. And yeah, it was first 5 days were pretty brutal. Then my body started to adjust. I actually had some sharp pains going through my head in the first, or with like day 3 or 4. I was actually pretty nervous about that because, well, I mean, I wanted to do the challenge, but I didn't want to risk my life. Um, and yeah, but then people started bringing me food and just making sure that I had everything that I needed. And yeah, I will say I could have done more, and I'll say I could have done more because I was also working. I was still running my company and so. if I was getting proper treatment daily, like getting massages, stretching, and fueling properly, I could have probably done like 75, 80 a day. So
So you
you know,
meant more steps per day, not like a longer duration.
no, I mean, I could have gone longer, but I'm talking about like more in the 30-day window. I could have
Yeah,
done.
you could have got more steps. Yeah.
Mm-hmm.
That's crazy. So you didn't like go somewhere to do this. You just did this throughout your normal day. Like you were still working, still doing
Mm-hmm.
all the stuff you had to do, and you just did it around that. That's
Mm-hmm.
crazy. Like I
Yeah,
thought you went somewhere and was like, I'm doing this for 30 days, and that's all I'm doing.
yeah, yeah. So we did this through the International Book of Records, and I think part of why Guinness doesn't have a record for this is because they don't like you would have to basically be watched
Hmm.
30 days
You
by
can't track it.
yes, it's so hard to track. So I do want to do that with Guinness, right?
Hmm.
And maybe it's somewhere in like Arizona or somewhere I don't know, somewhere cool to witness. And
You gotta go in the winter time if you can go to Arizona.
yeah,
It's gonna be way
right.
too hot.
Man, it was. I was in Arizona one day. And it was like 99 degrees at midnight.
Yeah, it'd be like 120 during the day.
You
That's
know?
crazy.
Yeah, it's insane.
So when it comes to, so you didn't have no plan really. You just walked whenever you could. Like you just in between meetings, you walked. Going to work, you walked. Like there was no plan. Like I'm getting up and I'm gonna get 10,000 steps in first thing in the morning.
Yeah. So it got to the point where I was doing about 4 hours first thing in the morning. So I wake up, I go walk on the levee. So I'm sure you're familiar with levees in New Orleans, but for those who don't know, basically just these are the kind of barriers that protect the city from
Hmm.
flooding. And so I'll go out, I'll walk 2 hours one way, 2 hours back. That'd be kind of like my morning typically. And then I would go home, shower, um, drive to the office, maybe chill in there for like 10, 15 minutes. 'Cause I only had 3, maybe 4 hours of waking time that I couldn't be walking.
Hmm.
So I got 24 hours in a day. Ideally, I'm sleeping like 6 to 8 of those. And then, so now I'm working with like 16 hours. Well, I got to walk nearly 13 hours a day, 13, 14 hours a day. And so I'm left with, getting about 4 hours a day, depending on how fast I'm walking to not be doing something. Yeah, I mean, I would always get anxious anytime I was sitting for like more than 30 minutes. I would just be like, I got to go, guys.
How did you track your steps during the time?
Yeah, so I tracked Apple Watch and phone.
Hmm.
And then I have a step, like basically like a leaderboard tracker in our app, right? So again, big part of what we do is we do these challenges, and so there's a leaderboard, a real time leaderboard showing total step count. So that's how I saw the cumulative steps on a daily basis.
You said you ran a 10K during this time. Did those 10K steps count towards your day?
No, technically they didn't. That was also another annoying feature of it, right? So the record was 1,970 not wait 1,971,000 288 steps,
Hmm.
right? And so I finished with 2,007,178, but about 10,000 of them were running from that
Hmm.
race. And so technically 1,999,000 or yeah, 7,000 or yeah, whatever, 10,000 minus that was about how many I walked.
So, but that still counts as steps, though, right? If you ran it, it still counts
Yeah,
for your
but it's
steps.
technically it's for walking steps.
Yeah. Okay.
Mhm.
Yeah, I was about to say you're running, you're still taking steps. I think
Yeah.
that should count because that's
Yeah,
that's
yeah,
even harder. That's even
that's
harder.
yeah, yeah. If I had to run 2 million steps in a month,
Yeah, it would destroy your
I
body.
would I would have been burning like 6,000 calories a day. I just don't even think that would have been possible.
Well, I think your body, you would destroy your legs. I don't know
Yeah.
if you can make it. Like these dudes that run these 300-mile races, I don't get how they do it. But then again, they're only running like 5 days. You would have had to run 30 days. So like, I don't think you
Hmm.
could have made it. I mean,
No,
you,
I don't think so,
that's
man.
crazy.
And like as excited as people got about this challenge and like following along, like people were really excited. But I'm really all about longevity, and there is a point of
Hmm.
diminishing returns, and
Oh, for sure.
I certainly reached that for sure. Like that isn't something to sustain. Like I did more steps in a month than most do, or I did as many steps in a month as most people do in 2 years, or
Hmm.
just to kind of put it into perspective. And so when I see like these ultra athletes and marathoners and things like that, I really regard these as professional events. Right, these are professional feats that, just like any other professional sport, comes with trade offs. If you're a professional football player, you're gonna there's an opportunity there, right? You're gonna potentially make some money. If you end up a professional or now in college, you can you can become super wealthy in college now, and that's great. But yeah, there's still trade offs, right? But there's wear and tear on your body that will come at a cost to you potentially in the future. And so I'm not really big into marathoning and ultra stuff. And it really was in 20, I want to say 2017, 2018. I was working at a plant-based heart clinic where basically a doctor, we treat diabetes and hypertension patients with prescribing them a whole food plant-based diet. And so they would, we do medication too, but their main thing was this kitchen connected to the clinic, and people would be prescribed these kind of like meal kits, and they would come down or off their medications in a matter of a month, just from eating or removing stuff from their diet that they shouldn't be eating, and then making sure they get the nutrients that they need. But anyway, the majority of the patients that came in were, again, people who were dealing with type 2 diabetes, hypertension. But then there was this one guy who came in who was like a career Ironman athlete, and he had scarring on his heart from all of the work, because your heart is a muscle, right? And
Mhm.
so that really would kind of raise my awareness around like the potential risk of these ultra endurance sports, and just like something that people should be mindful of. Um, Doing it once, cool, like doing it a couple times, or maybe something that you do once a year or whatever. But like to make it like a regular thing, just know that it comes with trade offs. It's not all good, you know.
Yeah, I like the endurance stuff though. It's
Hmm.
kind of a it's one of the, I just started doing it recently, so I've actually
Yeah,
done Ironman as well. It's funny you
nice.
mentioned that.
Yeah, yeah. Hmm.
But yeah, it's definitely definitely there's definitely diminishing returns when it comes to these ultra endurance sports and things like that. And it's not something you could do very long. I mean, you got a short window when you can really
Yeah.
compete at these
Hmm.
things. I mean, if you want to professionally compete, yeah, you could do them a long time, like if you're just doing them recreational. But then again, you're probably not pushing your body to the extreme maxes that these professionals are doing it at. But
Yeah.
yeah, I like how you preach sustainability. I think that's awesome. And you like to do steps, and I
Hmm.
think steps or walking is a great form of exercise that is very very underrated. And it was even underrated by me. Like I used to hate on walkers. I swear, I used to be bad about this. My wife loves walking, and I used to hate on her. I'm like, you need to do something. Like you got to run, you got to work out, you got to do something. But she
Hmm.
loves walking, and now the older I've got, the more wise I've got, and I realize that walking is a great option, especially for like the normal like majority of people. Walking is a lot better option than running for a lot of people because it's sustainable. It's like you said, it's
Hmm.
sustainable. Everybody, pretty much everybody can do it.
Yeah.
It's not very hard on your body. It's not taxing. You don't want to like you don't want to quit. When you're running very hard, you pretty much want to quit. So you can do
Yeah.
it. And it's just a for the majority of people, it's a great exercise. Yeah, it's not going to burn a ton of calories, but it's very easy to do. It's accessible. You can do it pretty much anywhere. It's sustainable. You can do it day in and day out. It's
Hmm.
not like you're beating yourself up every day trying to do it. And
Yeah.
I think it's a great tool that people should use more often. So
Yeah.
I like how you preach getting steps in. It's a good form, and it's something that I take to heart nowadays too. Like I try to get my steps in, even
Nice.
on like days that I'm not running. I'm trying to get. I go for the 10,000 steps because I'm an overachiever, so I got to go big. But
Naturally.
yeah, you probably don't even need 10,000 steps for most people, but just get more than what you're getting now, and you'll be in a good position.
Hmm. Yeah, no, I was the same as you, man. Like, again, especially coming from a running background, never really
Hmm.
felt like walking did much. But one thing, the most interesting thing about my first kind of like longer steps month when I did the 1 million last year, my resting heart rate got down to 42 beats per
Hmm.
minute, and all I was doing was walking that month. It hadn't been that low since I was in like peak shape in college, college training. And so, yeah, again, that was one of the most significant things that I saw from walking. And if you can do that for me, in less than 30 days, and I can imagine what it can do for people who are coming from like the couch to whatever their new fitness journey has them, wherever their new fitness journey has them. And so, yeah, walking is powerful. And even if you're still dealing with like weight problems, as you're walking, just know that it's making a difference, because even they did a study where people who were like overweight or obese who were active compared to those who weren't overweight or obese but inactive, those who were overweight but were active lived longer, even if they were overweight. So exercise is and moving your body is so important, and can save you, even if other aspects of your health aren't necessarily optimal.
Yeah, sitting. I've heard somebody say this before. Sitting is the new smoking. Like
Mhm.
sitting is so bad for our health, and we're so sedentary nowadays, especially with the way the world is. Well, most jobs are desk jobs, and we sit down and watch TV all day. So I've
Mhm.
heard some. I can't remember who I heard say, but they said sitting is like the new smoking. So
Mhm.
I think it's great for people to just get up and be active. If you think about like our ancestors, they didn't sit all day. They were up moving, hunting, like doing working, doing things all day. And I think we need to be more active, but it don't have to be running 100 miles. It could just be walking a
No.
couple
Yeah, yeah.
thousand
You
steps a
could
day.
just be walking. Yeah,
Yeah.
yeah, yeah. Yeah, I think you make a good point there. Um, and not even that far back in our history, say in the 1940s, 50s, we were on average consuming about 2,600 calories a day, 2,600 calories a day. Now the average American consumes about 3,600 calories a day, 32 to 3,600. We're eating 1,000 additional calories, and we're burning fewer calories. So naturally, the outcomes are what they're going to be. And I don't think
Hmm.
that most of us realize that. I think a lot of us think we're just eating like normal, or whenever we're hungry, we should be eating. But we're overeating, and it's directly correlated to the current state of our health, and then obviously matched with the sedentary lifestyle. Right? If we were still moving around like we used to, then maybe we'd be okay. But right now, we're not moving enough, and we're overeating. So
Yeah, not only are we eating more calories, roughly 1,000 or so, we're also eating a bunch of junk calories that don't have
yeah,
any nutritional value. So those you said back then they're eating 2,600 calories.
and then I was
Yeah,
real.
that for some people that may seem like a lot, but that's 2,600 calories of like good food that's healthy for you.
Real
It's probably
real food, yeah.
meat, vegetables, and fruit.
Mhm,
No, like preservatives or anything. That's like organic,
mhm.
good for you food. So like honestly, that's probably all they could eat. They probably couldn't eat no more because they were probably full. I mean, they couldn't
Right,
eat no more. You
right.
try eating 3,000 calories of nothing but whole foods. It's a lot
Mhm,
harder than you think. If you just ate only whole foods, I don't I wouldn't restrict you to a calorie limit. Like I would say,
mhm.
if you eat only whole foods, eat to your full, and you're good. Because like you're not
Yeah,
gonna overeat. You try to overeat whole foods, it's just not gonna happen. You're gonna get
mhm.
full before you can overeat because it's so satiating and there's not as many calories in it as like
Yeah,
junk food. Junk food don't fill you up and it's
no.
loaded with calories. So that's why we eat way more than what we should be eating.
Mhm. Yeah, and we evolved with that food, right? So obviously, again, the all of the chemical processes that are happening while we're eating the food are help us understand when we've eaten enough, right? Part of what's
Hmm.
happening with these foods is like again we're able to just eat and eat and eat, and our body's not letting us know that we're full because these foods are laced with chemicals that are designed to disrupt that. And so I'm sure you're familiar with like all the GLP-1s and the Ozempics and stuff like that that are coming out. Those drugs basically are designed to treat that condition. They're calling it a condition when you basically can't tell when you're full. And when it's really just these foods are hijacking our brains. And so now we need a drug to tell us when we're full. Um, and they're even prescribing this to children, because obviously the obesity epidemic is reaching younger people too. But now the food companies are designing food products to bypass the GLP-1 and the Ozempic, mechanisms. And so this is never ending, man.
It's a crazy world we live in. I don't get it. I am glad that the government's trying to start, ban some of these things like the
Mhm.
dyes and stuff. I think that's a good thing, and we're starting to move in the right direction. So hopefully, fingers crossed, they'll start,
Mhm.
trying to make us healthier, uh,
Yeah,
for the
one
long term. Like why put all this stuff in there? It don't make sense to me. And just because you want to make it a certain color, like I
yeah.
don't care what color it
I think
is.
two things. I think two things are happening with a lot of these things. It's like there's one like they want to sell more food. That is their
Hmm.
objective, to sell as much food as possible. But then there are a lot of these like industrial byproducts that just naturally occur in the process of creating all of the food. And they're like, well, we could throw these byproducts away, or we can try to figure out how to sell them or
Hmm.
incorporate what we do. And I think that's where a lot of them come from. Again, I'm not saying all of them, but that's really it's just I mean it's just capitalism, and sometimes it comes as an expense, at an expense to people. But yeah, I agree. We shouldn't just try to put some red dye in there just because it was a waste product and we need to we need to make some money off it. Like you know, I'm really concerned with the fact that the country even let it get to this point, because it, I feel like nothing happens in this country by accident. I don't think really anything happens within leadership by accident. If something happened, then then that was what was intended. At least that simplifies it for me, you know. And it makes me think that they don't care that the population gets to where we're all sick and obese, because that's what the outcome is. And so because they don't seem to care, again, this is just me going based on what we see, then it's absolutely on us to make sure that we prioritize our own health. And again, like you're saying, leadership seems to be making some strides to change that stuff as well, which is good. But yeah, I wouldn't bank on it.
Yeah, and people are finally starting to open up their eyes a little bit. They're starting to realize that hey, they're literally poisoning us. Like,
Hmm.
and people are just now realizing it. Now that obesity rates are through the roof, and we got social media, which helps push this a little bit, which is a
Hmm.
good thing.
Yeah.
So people are finally starting to wake up a little bit and starting to make healthier choices. You're seeing a lot more organic foods or
Hmm.
labeled foods in grocery stores and stuff. Which, in my opinion, it's bad that a grocery store has to have an organic section. Like everything in the grocery store should be organic, but
Hmm.
we are where we're at now. So,
Yeah, or a
but
healthy food aisle. That's
yeah, like there should be such thing as a healthy food aisle, or there
right.
should be such thing as eating healthy food. It should just be food.
Yeah,
Like,
it should just be food. Yeah.
but it
It
is
makes you
this is
think, what is the rest of that stuff in there? If this is the healthy food aisle, what is the rest of this stuff?
yeah. I always like to tell people when you go in a grocery store, you shop around the outside of the store.
Hmm.
Don't go in the aisles because that's where all the junk's at.
Absolutely.
So that's a good little rule of thumb for everybody out there.
Yeah.
We'll go back. We'll go back to your world record. When you mentioned a little bit that your body didn't function well the first couple days, but like
Hmm.
how did your body hold up over time? Did you have any injuries? Did you have to overcome anything? Like I'm thinking 30,000. I mean 30 miles a day. You had to be hurt. Like you had to be hurt
Yeah.
yourself. So how did that all work out?
Yeah. So the first 5 days, the majority of my pain was kind of like on the inner part of the back of my knee, right? So that tendon right there. I mean, I couldn't. It was so tight. I don't know if you've ever like had a tight tendon, but like you can feel it almost like rubbing
Hmm.
whenever you're like stretching it out and contracting it. Like for 5 6 days. Honestly, I think it was for the whole time. Like it was just tight, and then some of that worked its way down the rest of my left leg. And I think it was maybe on the 11th day, I was doing like a cool down, kind of like baby jog. Um, and I started getting some significant pain in my Achilles, right? And so that's obviously not something that you want to play around with at all. And so I pulled up and just kind of started walking again. And I was doing this walk. So walking, technically, you have to have 1 or 2 feet on the ground at all times, right? But even when I was doing kind of like that kind of stronger walk, I would still get significant pain just from any get pressure trying to drive at all. And so I pulled up, and for the next 8 days, I really could not do put any type of significant pressure. Again, I could walk with no pain, but any effort to try and do a little jog, significant pain. And so yeah, I was already not planning to run the 10K that was on the 19th, because I just didn't want to risk an injury. This was before my Achilles started bothering me. Because even if I felt like I could go, that didn't mean that there wasn't something in my body that was on the brink of collapse, just in the right moment. And so, but I still really wanted to run, because me and my run club, we had been training for this race pretty much since we started about 8 months before. And it's the day before the run. It's the day before the race. We're at the expo. So Bear Health, we had a booth at the expo, and I'm like walking around the expo endlessly again, because I didn't have time to manage my booth. I had some interns doing that, but I'm just walking around there the whole time. And then as I'm walking around, I hear someone going on stage. It's a podiatrist going to like talk about foot stuff, for like the race tomorrow. So, oh well, maybe he has some tips for me if I want to like maybe be able to run tomorrow. So I stop and then I explain to him what I'm doing. Like, hey, I've already taken 1.2 million steps this month. I'm trying to go for 2 million. I really want to race tomorrow. Do you think it's worth the risk? Do you think I'm gonna like tear my Achilles if I try to run? Because it literally it's 10 out of 10 pain every time I try to run. And he's like, oh well, I think as long as you're stretching, and maybe you might want to put a couple heel inserts, or put a heel insert in, just to kind of take some of that pressure off the Achilles. And I think you should be fine. I'm like, again, in my head, if like just watching people run, I'm like, how are y'all doing that? Like that's how bad it was. You know, I'm sure you've kind of experienced that before. When you're like completely immobilized and you see other people, you're just like, wow, I wish I could do that. Anyway, so I walked from the hotel that the expo was at to Walgreens nearby, and I picked up some heel inserts and took it for a spin. And all of a sudden, I can run with no pain. I couldn't believe it. Just like that, I mean, instantly, you know. And then so I ended up running the next day in the race.
Yeah,
Mhm.
you're like me, man. I would have ran too. I know it's probably not a good thing to do, but
Mhm.
when you want to do something, you got your mind to it, you gonna do it.
Yeah.
I'm kind of the same way.
Mhm.
So how many calories a day do you think you were eating?
Eating? Oh, I don't know, man. Not enough. That's the thing because I also fast on a regular basis, and so I wasn't even though I was obviously burning a lot of calories, I wasn't super hungry every day because a lot of hunger is driven by how often you eat. And since I was typically eating like once or twice a day max, I wouldn't necessarily be hungry throughout the day. Now, when somebody put food in front of me, it was gone in half a second. But I was burning 25, 26 active calories a day. That's
Mm,
on top of my resting calories. And I definitely wasn't eating 4,000 calories a day, which is what I was basically burning. Now, granted, I only lost about 5 pounds throughout the whole process, but I didn't have much to lose really. You know, I'm a buck 45, so
mm-hmm.
you know, didn't have much to lose. But yeah, my body survived, man. You know, that's like I said. I was just trying to get through it, and it's like next time I definitely have a strategy and have everything in place so that I can really see what I'm capable of. And as I was kind of knocking it out and I was ahead of pace the whole time, I was like, I know this is the world record, but I don't think this is the extent of human ability in this feat. I knew kind of early on that someone can do more than this. And so yeah, I would be excited to see someone else take it on. And then we kind of start going back and forth, or me and the other guy kind of duel it out in a single month, go toe to toe and see who can come out on top.
Yeah, the nutrition's I think a big part of this because like you did it doing like your normal routine, but like if somebody like really wanted to do it, they would obviously wouldn't be working. They would be walking all day, and
Hmm.
like nutrition would be absolutely critical when it comes to
Yeah,
this. I know you're,
it's a recovery,
yeah,
right? Like being able to bounce back the next day. So
hmm
I do eat a whole food plant based diet, and again, but also I have a lot of endurance background as well. Um, but like your body not having to do that much work to process the food really goes a long way to helping you again bounce back, reducing inflammation, all that stuff on a daily basis. But then there's if I'm not eating enough, then I don't have the energy to keep going. And so that was
hmm
really the balance for me during the whole thing, and hydrating. I mean, it was just I felt so much better every time somebody brought me food, man, or like
I bet.
drink a bottle of water, just because like I definitely wasn't eating enough.
Yeah, I would be starving if I did this. I get hungry, but
Okay,
I don't
yeah.
know. Walking don't it's not as taxing. It don't burn as
Mm-hmm.
much fuel as running. But like I know, like if I gotta have a long run day, like I'm gonna eat a lot that day. My
Hmm.
body's trying to it's wanting me to eat. It's wanting me to kind of recover,
Oh
refuel
yeah.
and stuff. So I don't know. I just feel like walking that much. I feel like I'd be extremely hungry as well too.
Hmm. Yeah, no, I mean a lot of people who have done our challenges, like for example the Super Bowl challenge, uh, guys similar to us who never really regarded running or walking as like a part of fitness, army guy, and he said, so he was doing the challenge, right? And so you had to do 59,000 steps in a week, which is only I think it was maybe like 7,000 steps a day, so nothing crazy, but every 1,000 steps past 59,000 gave you 10 additional entries into the raffle. So one person was actually doing 50K a day,
Wow,
she did that for 10 days, 500,000 steps. I was like, why don't you go for the million too? You're already
you're almost there.
yeah, you're way ahead of pace. She didn't end up doing it, but there was one guy. He's like, bro, I was just eating nonstop.
hmm
Like I mean, maybe he was averaging maybe like 18, 20, 30K a day, something around that. And but he was like, bro, I was just eating all day. I was so hungry.
Yeah, I get the same way when I'm going through like my training blocks. Like when I did the Ironman,
Hmm.
I couldn't. I ate all day every day, and I still lost. I lost like 20 pounds doing that. But
Wow.
I was doing like 2 a days. Training,
Hmm.
swimming, and either running or cycling every day, 7 days a week. So it was a
Yeah.
lot of training. But like I could not get full. Like I would eat all day. Same thing with the ultra marathon. I ate a lot. I wasn't training near as much for that because I was
Hmm.
just running. But yeah, I was always hungry. Like
Yeah.
it my body couldn't keep up.
Yeah. What's the Ironman like, man? That's one thing I do think I want to try. I'm not like a great swimmer. Like I can swim, but I never.
Well, I will say this: swimming was the one I was the most worried about. So it's the one I trained for the most. Like
Okay.
I knew I couldn't swim very well, so I trained 5 days a week on training.
Hmm.
On swimming, and it actually ended up being my best one.
Okay.
One because
Nice.
you do swimming first, so you're
Okay.
fresh
Oh, well, that
and
could be cool.
yeah, you're fresh and you got adrenaline. Like it's very
Mm.
beginning of the race, you got adrenaline. It's the first thing. So actually, swimming for me was actually pretty good. Like I had a way better time than I
You did
thought.
the full Ironman.
Yeah, I did the full.
Nice.
So, and luckily for the one I did, I was able to wear a wetsuit. So I don't know if you're familiar with a wetsuit, but
Hmm.
it helps you float a lot.
Okay.
So it makes the swim a lot easier,
I'm
like
gonna
more
need
than you would realize.
it. I'm gonna
So
need
so the it's made out of they're made out of neoprene, and so neoprene floats. It makes you more buoyant.
it.
So
Okay.
it makes the swim a lot easier. I did the swim I did Panama City, the one in Florida. So we swam literally straight out off the beach, which is very sketchy. It's very scary, but yeah, it was very intimidating. But
Hmm.
actually, I knocked the swim out pretty quick. I think I did it in an hour and 9 minutes. I did the swim, so I was very happy with that time. So
Yeah. So
it was
in the
cool.
swim, like, are you able to like stop for a second?
Yeah,
Like.
you can stop. You can if you need to, you can kind of come over to the side a little bit because there'll be people swimming on top of you if you stop in the middle.
Mhm.
You have to move to the side. But yeah, you can stop. You can take as much time. Actually, they have I think you get 2 hours and 20 minutes to do it. Like that's the
Okay.
cutoff time. So you
Hmm.
you got as long as that to do it, and that's plenty of time. Trust me,
Right.
if I can do it in that time, I think you can. I had no swimming experience whatsoever,
Okay.
but I knew that going in, so I trained a
Hmm.
lot. Like I trained literally 5 days a week. Every morning before work, I went to the gym and I
Hmm.
swam. So I followed a plan. There's an app that I use. It laid out all my swims for me. So I use that and they helped a lot. And I did a lot of drills. So a lot of like swimming drills, which helped a lot with your technique.
Sure.
There's a lot of technique when it comes to swimming, more than you realize. So once you get that technique down and you learning how to breathe is a big part.
Hmm.
So once you learn how to breathe, it helps a lot, and you can swim a lot further when you figure that out.
Yeah. Makes sense,
It was
man.
cool though. I love the Ironman was very cool. I'm definitely gonna do another one. I want to do another one for sure. I don't
Hmm.
know. I kind of have like a bucket list. I'm doing different things, but I'm definitely gonna get another Ironman in there for sure. I really enjoyed it.
Yeah. Yeah. I can see myself doing one, man, for
Oh
sure.
yeah, I would say at least do it. You gotta do it at least once. You got
Hmm.
once. You never know if you like it if you don't do it. And you don't have to like you're already a runner, so like you pretty much you got the endurance down. So now
Hmm.
it's just all about like technique.
Right.
If you run as much as you do, your endurance is good. You just got to learn like the technique of swimming and then the biking. There's technique that goes into biking as well, but that's a
Mhm.
little easier.
That's 100 and.
It's 112 miles on the bike
Okay.
and
Hmm.
then the marathon on the run. So,
Hmm.
and I will say the bike was the one I was the most
Okay.
confident about. I felt the best about the bike going in, and it ended up being the hardest one to me. And it's just because the bike was so long. It took me like 6.5 hours to do the bike, and you're
Really?
out there like by yourself. I mean, yeah, there's other people out there, but like they're either passing you or you're passing them. So like you're always riding by yourself. This is a
Hmm.
long time to be out there by yourself.
Yeah.
And so it was brutal. It was more mentally challenging than physically for the
Yeah.
bike.
And I'll say, like, I know I made the point about like there being diminishing returns with this stuff, but I don't think that there's diminishing returns psychologically though when it comes
Mhm.
to these things. And that obviously has its advantages. So don't want to knock the sport too much.
Oh yeah, there's definitely a huge psychological side of it. It's definitely mental for sure. I mean, yeah, you have to train your body physically, obviously, for the race, but it's just as mental of a battle as it is physical for sure. Especially when it comes to your training, or for me at least. Like on race day, mentally it's not that hard. Like I'm pretty used to pushing myself because I do a lot of
Hmm.
events and I've worked out for a long time, played sports. So like when it comes to race day, like I'm pretty much ready to go. I'm amped up, ready to go. I'm good mentally. To me, I find the biggest struggle in training. Like when you get a couple months into a training block and you doing it day in and day out over and over and over and over again, like that's when I get in my head. I'm like, man, this sucks. Like I don't want to do this no more. I'm tired of
Mhm.
doing this. Like why am I doing this in the first place? Like why am I torturing myself every day? And I get that way in every like training block that I do, and I know that's just part of it. That's just gonna be part
Yeah.
of it, and I gotta fight through it.
Mhm.
And that's why I guess that's why I keep doing these things, because once you finish, it's rewarding. You get that benefit
Right.
from it. So it brings me back to doing these kind of cool challenges. So I did an Ironman, and then last year I did a bodybuilding show, which is completely different.
Yeah.
And then this year I did the ultra marathon. So I'm switching it up, doing
It's
different things.
nice, man. Maybe you'll go after the steps record. You
Yeah,
know.
that you got me intrigued now. I'm very interested. I definitely think I could do a million. Like if I was going to do it, I feel like
Yeah.
I'd have to go 2 million if I did it. But but I'm like you though. I work.
Yeah.
I don't I don't have that much free time when I'm at work. I couldn't get that many steps
Yeah.
in at work.
The
I don't know
million
how I would do that.
you can do a million around work, like
Yeah.
any type of work for sure. But in order like if I worked a desk job, I couldn't have done it.
Yeah. See, I don't think I couldn't get that many steps in at work. Um,
Mhm.
I don't know how I would do it logistically. Like I could definitely I work out before work, so I definitely could get several. I could probably get
Yeah.
10,000 in before work.
Hmm.
But then after work,
Yeah.
maybe another 10,000. But like
Yeah. You would need to
I
do
don't know.
like maybe like a 2 hour walk in the morning, 2 hour walk in the evening. You'll probably get the rest of them throughout your throughout the day with normal steps. So Um, I'm actually thinking about kind of like making this a like how all these companies or these brands have these challenges
Yeah,
that
you need to put a name to it and make it like a thing. Like the I like the what's it called? 75 hard. Like you can make
yeah,
a
exactly,
challenge like that.
something like that. Yeah, because again, everybody that has done it, these are like regular everyday people. These aren't again
Hmm.
former athletes, current athletes, anything like that. They're just regular people who end up losing 20 pounds, getting taken off medication. So, and they're all still walking today. So, yeah, I think that needs to become a thing. I
Oh yeah,
think.
you could definitely put some marketing behind it, give it a cool name, and it could definitely be a thing. I think people maybe add some other things in there with it. Like a little like I don't know morning routine or something. Like add 75 hard has like a bunch of different steps.
Sure, sure.
You could make a whole thing around. I think that'd be cool. That'd be interesting.
Yeah.
Maybe that could be part of like your app. You could
Hmm.
integrate it in your app somehow, and
Hmm.
that'd be a cool thing to
Yeah,
do.
for sure.
Where did the name Bear come from? Where does that come from?
Yeah, so it stands for Black Electronic Health Records.
Okay,
Mhm.
I didn't put that. So why is the B lowercase?
Just to differentiate between EHR and Black. So EHRs are electronic health records. These are what hospitals and healthcare systems use to like track information, health information.
So EHR is already like a thing. You just added the
Yeah,
B
so,
on.
yeah,
Okay.
that's why we kind of distinguish between the two.
Okay. That's cool. That's interesting.
Yeah.
I always like to see how people come up with their names
Hmm.
for things, because the people get
Yeah,
unique with it.
it was 2021. I was on the phone with a friend, and it was going to be called Beamer at first, so Black Electronic Medical Record.
Hmm.
Um, but thought we might run into some problems with BMW. And
Well,
then
and
also,
you, yeah, and if you're gonna call it a health score or a health record, like it makes more sense to do it EHR.
yeah, so yeah, so we came up with it.
Well, that's pretty cool. Well, I want to say thank you for coming on to the podcast. I enjoyed it. I love learning about your world record. That was
Yeah,
very uh, intriguing for me, and you may have piqued my interest. I may have to do something
yeah,
like
man. Let's see what we can put together. Get so you can get a month of PTO, or I don't know what you do for work, but so you can
definitely
make.
couldn't get a month, but I could get a week or two.
Yeah, 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 and but that's also part of the challenge, and part of what one person said at the end. He texted me. He's like, "Hey, man, you inspired us all. I'm out of excuses." And like a big part of why people aren't where they want to be is because they just allow themselves to make excuses about why they can't change. And he was just like, man, this dude just did 2 million steps in a month around running a startup. What am I doing? And yeah, that was the coolest part, man, just like inspiring people. It wasn't something I was thinking about going in. Like, I mean, it seems obvious that people will be inspired by it. I thought people would think it's cool, but I didn't really think people would come up to me and be like, "Hey, man, like you are me and my friend's inspiration." Oh, you're the walking guy, right? Like people, I'll just be walking throughout the city. They'll walk up to me and say, "Hey, you're the walking guy, right?" I'm like, "That's crazy," you know?
And that's what it's all about, man. That's why I
Yeah,
do the podcast. I mean, if I can help one person with each podcast episode that I do, then that was a win for me. That's kind of my goal. I'm just trying to help people get started and help people, stay motivated and just live a healthier lifestyle. So that's kind of the reason I do this. This is just I don't make no money from this. It's just a passion
Mhm.
project. I
That's
don't
awesome.
work in fitness. Like this is I just love fitness as a whole. So that's
Hmm.
why I do what I do.
That's awesome, man.
So yeah, so let everybody know where they can find you, where they can find the app, and all that kind of stuff.
Yeah, so you can find us on Instagram and pretty much all socials, although we're primarily on Instagram at Bear Health. That's BEHR Health. You can find my personal at Kwame Terra, KWAMETERRA. And then download the app. So go to the App Store, download our beta app. It's called Dacadoo. Again, it's DACADOO. And use access code, uh, just use access code launch, all caps, LAUNCH. And then get in there, create your profile, join a challenge. In July, I don't know when this will air, but in July, we're giving away 4 pair of on Cloud Surfer Maxes. They're currently unreleased. But if you burn a certain number of calories, you'll be entered in for a chance to win. If you take or a certain number of steps, you'll be entered in for a chance to win. Cover enough miles, so on and so forth. We got 4 challenges running for a chance to win some shoes
Well,
and
that's
get
awesome. That's awesome. Oh, one question before me. How many pairs of shoes did you go through when you did this?
one.
One pair?
Yeah,
Oh my.
covered nine. Now here, so I'm not going to tell you what shoes they were because I'm working on a deal right now. But yeah, one shoe, and I wore a few different shoes. Like the first day I wore, well, I'm not going to talk bad about anybody, but I wore some shoes, and I just didn't like them that much for what I was doing, and my feet they hurt so bad after the first day, and I'm like, again, how am I going to do this for 30 days? But then I put on another pair of shoes the next day, and I felt like I was walking on clouds. I just felt stronger, mainly because I just wasn't, you know,
Mhm.
taking as much impact, and so yeah, shoes absolutely matter. And once I figure out this whole sponsorship deal with them, I'm gonna tell everybody what shoes I was wearing. So
Yeah, shoes definitely make a huge difference. I learned that when I did my Ironman training. I was running in some like straight up trainers, like workout trainers, and then I bought a pair of actual running shoes. And man, it's like you said, I felt like I was running on clouds. It made a world of a
mm,
difference.
yeah,
So ever
man.
since then, like if you're gonna run, you got to get you a nice pair of shoes. And that's why I was interested in hearing about your shoes because I know
Yeah.
you put some miles on them shoes. I don't know how you did it in one pair of shoes. Like those
And
shoes got to be
honestly,
destroyed.
the shoes were already kind of done. Like I had already put a significant amount of miles on them from like regular training. So I was surprised too. But maybe a testament to the shoe and hopefully again.
Yeah, I mean, if you can make it through that many steps with one pair of shoes, I think those are definitely worth your money, whatever wherever
Some
it is. Hopefully the deal works out for you, so you can get a little.
Yeah. Hopefully it does. I was actually talking to ChatGPT about like coming up with some messages for how to like talk about the challenge and everything. And this wasn't something that I had thought about, but obviously, ChatGPT and AI does what it does. And it told me or determined that I had walked enough in May or in April to have covered the entire Gulf South walking.
Like around the coast.
Yep, the entire coast of the Gulf in 30
That's
days, 940 miles. Yeah.
dang, that's crazy.
I know.
Well, that's awesome, man. I'm excited to hear about what you do next and how far the app goes. I think you
Yeah,
got some a bright future in your near days. So yeah, thank you for joining the podcast. I'll shoot you an email when it goes live. So I appreciate it, and hope you have a great rest of your day.
yeah, man. Thanks for having me.
No problem.